Hi, this is Reeve Conover from Conover Consulting, and this is episode 3 of Beyond the Spreadsheet. Today, does the network really matter? Now, in the beginning, we didn't have networks. You went to whatever doctor you wanted, whatever hospital you wanted. It was just not a thing. And then in the mid 80s, when I first started selling Total Health HMO, which incidentally, our best plan in those days was $87 a month for a single. So things have changed a bit. When the HMOs came out, they were going to control costs by limiting your access to a network and by being there and being your advocate for healthcare, which of course never really happened. And then we got the point of service plans where people said, well, I like the HMO price, but I don't like that restriction. So the point of sale plan or the point of service plan was when you get service, you can decide, what do you want? You want to go to the in-network doctor and pay less, or do you want to go out of the network? Then the traditional insurance world decided that they wanted to get involved, and they're licensed differently, so they couldn't call themselves POSs and HMOs. So we got PPOs, preferred provider organizations, which are essentially the same as a point of sale program. You use our network and we will pay you more than if you go out of the network. And then those plans needed a cheaper place because they got very expensive very quickly. PPOs have no cost control at all. And we got EPOs, exclusive provider organizations. Now, what's the difference between an EPO and an HMO? Well, there are some technical differences because of the licensing and the platforms, but basically they're both plans where you have to use the network. So to the end user, there really isn't much of a difference. And the HMOs failed to control costs. So then we got rental networks and repricing. And there were so many networks. When I started selling HMOs, there were 23 HMOs just in New York City alone. Doctors' offices threw up their hands and said, I can't track all this stuff. I'm just going to bill what I want and let the network figure it out. And so the network did for a time. And people read their explanation of benefits and got even more confused. And then the so-called Affordable Care Act happened. It pushed down reimbursement rates. Tertiary care centers, the big teaching hospitals, refused to accept the new rates being paid and left the network. The better doctors, better in quotes, left the network over money, and there was general discontent. And the insurance companies then responded by saying, well, we can't have everybody leaving. So we're going to make many, many networks. You can spend more dollars and get the network that you need that has your hospital and your doctor in it, or you could spend less money and get a smaller subset of that. Some health plans I work with now have 4 different networks at 4 different pricing points available. So it's gotten a little crazy. And it became critical to know your network, especially now since almost no plans have out of network coverage anymore. So if you just say, yeah, I guess my doctor's in the plan, and he's not, it could cost you thousands of dollars. And the Affordable Care Act plans got skinnier and skinnier networks as well. And they don't cover you out of state except for emergencies. Suddenly now, we've gone all the way back to the beginning. All that's old is new again. We have reference-based pricing. There's no network at all. Go to any provider that accepts Medicare. The doctor gets paid 130% of the Medicare reimbursement rate. The hospital gets paid 150%, and it's saving our clients 10 to 20% off their current premiums with the same benefits. And there's even a chance for even more savings. What's the buzz? That's a conversation for another day, or you can call us for guidance. Are you confused? If you aren't a little confused, then I really haven't tried hard enough. At Conover Consulting, we always say you need someone on your side. Let us be that person for you and give us a call. Have a nice day.